products that have a large constituency are not really on the docket for prohibitionists to get rid of because there's too many people to defend it. I have consistently seen decreases in homicide rates and decreases in young male incarceration when marijuana is legalized. I think the ultimate lesson from the Purdue Pharma episode is that your innocence in regards to facts is irrelevant. So, where has public health actually been helpful in this regard? Man, this is tough.
I'm honored today to have with us for the second time Jacob James Rich, known to his friends as, I don't know, Jacob, what do your friends call you?
Oh, it's a few things. We have Jacob Solom at Reason, so all of the journalists call me JJ, but usually I go by Jacob.
Fair enough, Jacob. Jacob is a brilliant man, and he's a PhD student at Case or Case Western Reserve, whatever they call it these days.
It's always
and
changing.
he tells us a little about himself. He's maybe a conservatarian, conservative libertarian, perhaps, and touches on the fields of, I guess, where business and ethics cross medicine, including pharmaceutical policy and almost synonymous drug policy, although it can be illegal drugs and whatnot. So, Jacob, what kind of concepts are you working on right now? What are you working towards as a degree, and where do you see yourself and your role going forward? And to pack in another question, what are the major kind of health issues that our listeners and viewers will find most interesting amongst your work?
Sure. So I'm an analyst at Reason Foundation, and I focus on the regulations of mostly legal and illegal drugs, even though I do some general healthcare analysis there as well. And then I'm also studying for my PhD in epidemiology and biostatistics at the Case Western Reserve University School of Medicine. So my day-to-day basically is me trying to navigate whether I should be working on long form articles or short term stuff, like short form commentaries. And my topics of interest are quite broad. So, what I've been working on mostly is actually constitutional law and whether the ex post facto clause of the Constitution should apply to civil law as well as criminal law. There was a case in 1798 called Calder v. Bull. And the idea of that case was basically that the ex post facto clause, the ability to make retroactive legislation, should only apply to criminal law because that's William Blackstone's definition of ex post facto. But after doing some analysis and some investigation, I realized that that's not correct. So there's a lot of implications for the administrative state and what people call the deep state if they are not able to use retroactive legislation in the civil context, mostly in the regulation form. And then at Case Western, my dissertation touches on the opioid crisis and whether state-level interventions to reduce prescribing rates had any effect on mortality and addiction. And then I also write about marijuana legalization's effect on mental illness. I write about the statute design of prescription reimbursement rates through Medicare and Medicaid and the relationship between private prices and how pharmaceutical companies can weaponize private prices to increase their reimbursement rates. And that's mostly what I'm working on at the moment. Yeah.
That sounds like a full plate.
It's pretty full. Yeah.
So the marijuana thing. I wrote recently, kind of peripherally on this topic. The city of Newton, my lovely leafy Boston suburb, aka the Garden City, they passed a law which I think should bring up your libertarian hackles, wherever those are, a little bit, because they passed a law that if you're born after March something 2004, yes, forever henceforth, you will never be able to buy cigarettes in this vaunted state of Newton, which is locking arms with its neighbor Brookline as the two most silly cities in our oftentimes frivolous Commonwealth. Um, and the thing that as I was digging in this, um, it emanated from because it's happening here, and I have a Newton TV show, kind of a public service thing, and a guest who's not a smoker. He's a health guy, and he has no, he's not holding water for the cigarette companies. Um, he just doesn't like it. He says it's absurd. You're an adult. I don't like smoking. He doesn't like smoking, but you should be at 25 years old, 27, 35, or 50-year-old down the line. You should be able to buy them if you want to, if they're legal. But the funny thing is, to get to the point, the cigarettes are taxed by the state, and so they're very expensive. They get huge state tax, but the marijuana dispensaries get a big slice of their action cut back to the city. So between 3 and 6% of every sale goes to the city, and so they're cutting back on cigarettes, but they're not cutting back on marijuana. So they really cared only about lung cancer, emphysema. Marijuana smoke is retained much longer, and probably does exactly the same deleterious effects as cigarette smoking. And therefore, why go after one or the other? I think a lot of the centrality is because where your bread is buttered. The city of Newton gets its money, directly from the marijuana dispensaries and not from the cigarette companies.
Yeah, that makes complete sense. When you see cities and various municipalities taking actions, it often happens to be in their financial interest, or if they're doing any sort of regulation, it at least is not interfering with their financial interests. On the age to buy, that's only in the city, right? It's not going to be the entire state. So, I mean, they're going to run into the same issue that Massachusetts ran into, where the sales in Massachusetts obviously dropped after they banned the sale of menthol cigarettes and all flavored tobacco products back in 2020, after June 2020. But what happened was that everyone just went across borders, and then all the states surrounding Massachusetts got the tax revenue. And what was very interesting is that if you look at Massachusetts and you combine the counties that surround the state, net cigarette sales in that general region of the counties that surround the state and Massachusetts itself actually net went up. So the increase in the counties surrounding Massachusetts was larger than the decrease in Massachusetts itself. So I'm not sure if that exactly would happen where you're at, because it's really a tax difference issue that really contributed to that. Massachusetts just has absolutely horrendous tax rates. They're incredibly high. And once people ended up going to New Hampshire to buy their cigarettes instead, they had a tax rate that was less than half that rate. So they obviously would buy their cigarettes in bulk. And that's really what contributed to the increase. But yeah, these types of interventions, not only do they infringe on freedom, but they often just don't accomplish the goal that they have in mind. And cigarettes are becoming less and less of an issue all the time. Smoking rates among youth are by far the lowest they've been in measurable history. And if you try to measure smoking among Black youth, you actually can't, because it's so small. It's so small that it's unmeasurable. So the issue with smoking is going to solve itself as young people grow up, because if people grow up to have smoking habits because they had smoking exposure in their youth. And with so few youth having smoking experience, probably within 20 to 30 years, it's not even going to be much of an issue. But what's really interesting about that is that the regulators actually somewhat target prohibition based on use. So products that have a large constituency are not really on the docket for prohibitionists to get rid of, because there's too many people to defend it, versus product classes that have a smaller amount of people. There's fewer constituents to block those types of prohibitions. So what's ironic is, as smoking becomes less of a problem, regulators are going to increasingly try to ban it.
The funny thing is they get so much money from it. Will they kind of have their own kind of withdrawal um, shakes as their revenue goes down from cigarettes? And how much does a state tie itself towards the vice it's prohibiting when the revenue is good? The lottery. I mean, they hated the lottery used to be kind of a low level crime thing, a little bit of maybe town mafias and whatnot would run the numbers and whatnot. Now the state has a lottery, and it ever expands into legalized gambling and so forth. It's I think somewhat along the Reaganistic dictum of when a business is, first you tax it, then you regulate it, so forth. I forget how exactly that goes. Then it's there forever. But is there going to be some kind of contrary aspect where they want to kind of retain the goose that lays the golden egg?
I'm not exactly sure. Obviously, all sorts of large conglomerate entities work in a somewhat profit maximizing space, whereas they would like to increase their revenue. But if you look at states like New York, the tax rate in New York on cigarettes is so high that they're actually like preventing revenue because over 80% of the cigarettes that are consumed in New York are actually sourced outside of New York. And if you think of the Laffer curve, very famous idea that if your tax rate is too high, you actually reduce revenue because you reduce production. That's exactly what's happening in New York and New York City. So it wouldn't be unprecedented for entities and governments to forego income in order to push forward a public health goal. But yeah, I mean, the revenue incentive is definitely there. And it might actually have something to do with the specific entities within the government. So if the regulator itself gets tax revenue, it might not really want to regulate. It might not want to reduce sales. But if there's basically like a permanent earmark of how much money this organization gets, regardless of the tax revenue, then they're probably more likely to start regulating. And that's probably why, like the ATF and various uh, organizations at the federal level that collect tax money don't really hammer down on what they regulate because they actually get direct money from the a lot of the products that they regulate. So it wasn't until FDA was involved with cigarettes at the federal level that you saw massive types of regulation. And it's no coincidence that the FDA itself doesn't have a earmark of the tax revenue going back to them. So whatever happens, whatever regulation they put forward and however they affect the market, they're actually insulated. So I bet you there's some political economy government structure issues that are actually contributing to governments, as a whole going after the organizations, but that subset of the government isn't benefiting from the tax revenue anyway, so it doesn't care.
It's an interesting aspect. We see this. You're a putative epidemiologist, and epidemiologically, we see that viruses succeed when they don't kill the populace.
That's
They
exactly
spread
correct.
they spread better. So that you have transmissibility, or you have virulence. You can't have both, which is something that was clouded over and eluded by our public health elites. Every version of COVID that came around was even worse than the other because more and more transmissible. Well, dude, that means it's less and less dangerous. But
Yes.
even Tony Soprano figured this out. Like when they get their juice off a company, and it could be I think one episode I think was Jamba Juice, literally. They want to get 10%. They want to get 5%. They don't want 100%. They don't want 80% because then the business closes down. So you can't be a reasonable parasite by sucking everything out of the out of the host. In that case, you're a hyena or something like that. You're a predator. But in order to be a good parasite, you just have to take enough off that leaves the the business like at least limping along, so you can get some more tomorrow. But as far as marijuana, what are the kind of incentives, perverse incentives that are happening with marijuana? And has it been good from a public health standpoint? And what are your other forays into it? Has it led to a kind of a more uh, dissolved and potentially dissolute society that doesn't grow up in the pubs and whatnot, where there's people playing pool and billiards and hanging around and singing songs, and kind of like has more of a personal get high aspect, but solitude and solipsism and whatnot. So I don't know if you want to address whatever aspects. I mean, I don't know if any of those touch on your work or theories, but what's the marijuana phenomenon writ large and writ small in the U.S.?
Sure. So if you see increasing use of any sort of substance, typically that increase in use is temperate use, meaning that it's not people who are using it every day. So if you look at the subset of marijuana users who are using probably like once a month or very occasionally, I don't really see that contributing to public health in any meaningful type of way. Um, but increasing access for people who are heavy users, that's kind of a double edged sword because if they have increased access, they're going to use more, and the harms from the drug use itself can definitely rise. And maybe you have some people at the margin of heavy use who wouldn't have been heavy users if they didn't have so much access to the drug. But at the same time, when you start prohibiting a substance, it's those heavy users who are the victims of the criminal justice interventions. So, what's healthier for them, to have an environment where they can safely use a drug, or an environment that heavily incentivizes them not to use it? And when it's actually a close call like that, I'm usually on the side of freedom. And from a broader public health perspective, the increase in use could alarm some public health advocates and whatnot. But another thing to think about is the secondary effects. What happens in other aspects of public health after the legalization? And from my work, I have consistently seen decreases in homicide rates and decreases in young male incarceration when marijuana is legalized. And going to jail is not good for your health. Getting murdered, I don't think, is very good for your health. And it's really the libertarian argument on this is that the government can be much more efficient if it focuses its resources on more important issues. And marijuana was a criminal justice issue that had a significant amount of government resources going towards it. And when the police departments don't have to focus on that anymore, they can start focusing on murders, focusing on theft, and things that everyone agrees are problems.
Yeah. It's interesting, some of the ancillary crimes to drug use has to do with the kind of scarcity issue.
Of
Um,
course.
on the other hand, there's also, I think, a moral component. And
Oh, for sure. Yes.
I spent a near decade um, dealing with narcotic addicts who wanted to stop. And I had a sobriety based program. I did a gradual 4 month taper using Suboxone merely as a scaffolding, a threshold from which they could come out from which they could come their drug habit, reduce it, and so forth. Get to a null state of no drugs at all. Um, does legalization kind of for you go across the board for all drugs?
Yeah. Yeah. Legalization, I think, is something we should pursue for all drugs. But this is where you were alluding to my conservatarianism. So, politically and from a policy perspective, I'm about as classically liberal as you can get. I'm not an anarchist, but somewhat of a minarchist, where I think the government should be mostly focusing on national defense, being able to prevent crimes, and then enforcing contracts domestically. So basically, the government is the monopoly of violence, and we want some sort of democratic control over that violence so that it's not weaponized against people who don't have resources. But other than that, I don't think the government really should be intervening in what people use. And the conservatarianism comes in that I think drug use is often immoral. I'm not the type of libertarian who thinks drug use is morally indifferent. And oftentimes, if you are wasting your life away because of substances, that is very sinful, and you shouldn't be doing that. But, I'm an Orthodox Christian, and I think much about what the church fathers say about these types of moral dilemmas. So, John Chrysostom has a famous sermon where he discusses how if we want people to change their behavior, we should not coerce them. We should be persuading them. And I try to be, in my public self, like that type of person. Like you do have the freedom to do what you want if you're not hurting other people, but you don't see me being an absolute hedon out there. And I think Christians should be much more vocal and in the public about their lifestyles and why people should be following what they do. You kind of lead by example in that sort of way on morals.
Well, that's excellent. That which is encouraged flourishes. Um, the example I might use is the gay marriage statutes. However, one feels about that, and I kind of see the term as a little bit of an oxymoron myself, but whatever you want to call it, partnership or consolation, whether marriage or not, had its kind of civil ramifications and whatnot, but those extended throughout the education system. Once kind of there was the equality of marriage, then that marriage was the same. So you have to teach the sexual apparatus and workings in the schools for gay marriage. So literally, we have teachers now. I guess I don't know about advocating, but explaining anal sex. Somehow I got through my public school and private school trainings without getting school lessons in that context on that topic. And then it extends to apparatus and toys and stuff I'm not really going to get into or have get into me either at this stage. But with drugs, if everything were kind of legalized, are we at the stage where we have to do the same thing for opiates? The right way to inject, or how much fentanyl can you find? Your good fentanyl, your bad fentanyl. Or do those things all disappear because Pfizer's making it at that point? I don't know. What are your thoughts on that topic? Like the encouragement of the state for certain moral issues by tacit legalization.
Sure. So this is tough because it kind of comes down to like what is the probability that the children are going to be engaging in such behaviors. If it's a behavior that we should be attempting to eradicate, there probably should be absolutely no instruction there. We don't want to in any sort of way communicate that such behavior is okay at any form at any time in life. But for behaviors that are able to be consumed in a temperate way, um, some sort of discussion about what like temperate alcohol use looks like, I don't think is absolutely absurd. And just discussing what happens to people when they use substances. I thought something that was very compelling when I was in the drug program in my public school. They had like an anti-drug program. It wasn't called DARE, it was called Plus, but it's basically the same type of thing. But they showed us a lung that was taken from someone who smoked cigarettes their whole life and it was all black. They gave us some testimony of various people who use dangerous substances. And I thought that was actually persuasive when I was a child. I listened to it. There is some narrative that creates some sort of counterculture and gives children a way to rebel. But I think that rebellion basically exists regardless. I don't think there's anything wrong with communicating truthful information about the harms, but trying to put forward information to incentivize the safer use of things that are inherently harmful, that sounds absolutely absurd. And the examples you were just giving, I hope they're not that prevalent throughout the country, but from great reporting by people like Corey DeAngelis and whatnot, it seems like it's definitely above zero, and above zero is unacceptable.
Yeah, I mean, I didn't live a completely sheltered childhood. I grew up in New York City. I remember at some point, when I was in junior high age, somebody pulled up in a car and is like, a guy is like, "Come on, you want to go into town? You want to drive?" Whatever. I didn't even know that was a thing. Whatever. And I walked around Times Square as a 12 or 13-year old. There was a lot of kind of it was in the funky maybe disco era. Thick shoes, thick hairdos and whatnot. But it's like, yeah, there's stuff going on. I could see it, but it's not the same as glorifying it.
Sure.
Having some kind of illegality to it. People argue, victimless crime. Well, prostitution, victimless crime. So you legalize it in certain places like Nevada and whatnot. Is that a net plus? And I suppose I come back to kind of the marijuana question we were discussing. Um, what happens when the state becomes involved in part of the money pathway when they get their bread buttered by the outflow of certain activities which are not intrinsic to a successful society or I suppose conducive towards a successful society. Now, does society improve when these things are quote unquote liberalized?
I'd say overall the answer to that question is yes. And the state's involvement with prospering from the tax revenue from such activities is a double-edged sword, right? Because if the price of something is lower, then it's going to be consumed more often. And if the state tries to increase revenue, they are going to have to tax it, which ends up inevitably increasing the tax or increasing the total price, which should reduce sales volume and revenue to a certain extent. Now, maybe your concern is whether the state sees this as an opportunity and then, after setting some sort of tax rate, goes forward to encourage the use of various things that could be harmful in order to further increase its tax base. And I mean, if anything like that was happening in any sort of regard for any sort of product, I would be against it. But um, I'm kind of outlining a hypothetical at the moment, but I actually don't know where that exists. I mean, I don't see the federal government advertising for cigarettes despite it getting a tax revenue from cigarettes, right? I don't see them doing that for alcohol. I barely see them even doing it in the public health space. I mean, they should be doing it less in the public health space, but even that type of messaging is quite rare. So it's something that could potentially be a problem, but it doesn't seem like it's much of an issue at the moment.
Hmm. So both of us have taken an interest in Purdue Pharma, and I would put this up as maybe the kind of aspect of the fickle finger of fate, to quote Laughlin back in the day, um, where Purdue Pharma was, in a sense, kind of the good student in class. Um,
At least the best student.
Thank you. Yeah, and they came up with this thing called the AFD, excuse me, ADF, abuse deterrent formulation. Thank you, ADF. Um, and so there was what I call OxyContin 1, and then came along OxyContin 2, which had basically kind of a waxy matrix or whatever that prohibited your snorting it or injecting it and so forth, like you could some of the other narcotics. And so it actually that formulation became the basis for Suboxone, which was an older medication, buprenorphine, and rhymes with morphine as a narcotic itself. And so that so the government wound up promoting that for the next phase of methadone treatment, Suboxone treatment, for narcotic de-addiction. But it was Purdue was so successful; it had this kind of boutique formulation because they had these patents and so forth. They were making higher margins, and they became let's say Fendi versus Macy's, selling its product, its kind of particular handbag, at higher prices and higher margin, but perhaps less of a legal resources than Macy's had. And they were the ones that were shot down by the government, which had benefited in a sense by having, frankly, narcotic users and abusers stopped using OxyContin. And the other companies like Mallinckrodt and whatnot could have followed this formulation, and we could have gotten away from misuse of prescription drugs into injection and whatnot. But they were wound up killed off. I don't know. Is there any lesson there? I mean, what's is there amidst all that murk? I mean, it's still kind of blamed as the causation of the opioid epidemic, which I think is absurd. Maybe you can just tell us your thoughts and formulations about either that Purdue episode or what it tells us.
Yeah, I think the ultimate lesson from the Purdue Pharma episode is that your innocence in regards to facts is irrelevant. If if AGs and the government politically want to come after you, they will destroy you. The government has sufficient resources such that your innocence is absolutely irrelevant. And it's interesting because basically the government was coercing Purdue to take an action to make this abuse deterrent formulation. And then after they did so, there was massive substitution to the illicit market and illicit drugs. And then that increased opioid deaths further. And then the government just blurs the lines on why that happened and just blames Purdue Pharma for that as well, when it was the government who instructed them to make the abuse deterrent formulations in the first place, which caused the substitution to the illicit market. So if you're trying to run a business, best advice is just to stay out of the news. Martin Scarelli, when he took over EpiPen, didn't look like he was actually doing anything illegal, but he made a bunch of people mad, and then they started investigating him. And if you investigate anyone long enough, you'll find something that's illegal because I mean, I think there's a famous book. It's like 4 felonies a day. I forget the exact number, but like technically every single citizen, no matter how good you are, actually commits some sort of crime every day. And once everyone's looking at you and people want to get you, they're going to be able to find you on something. And then you're going to have like millions of dollars in a legal team to defend yourself. You probably don't have that. In Purdue Pharma's case, maybe they were one of the revenue leaders in opioids, but other pharmaceutical companies are revenue leaders in hundreds of drugs, multiple classes of drugs. So Purdue Pharma was, like low $1 billion player versus like Johnson and Johnson, which is like over $100 billion and whatnot. Obviously the resources to defend yourself are very different. And the AGs, just like the tobacco regulators, they'll see companies, like they'll see products that they want to remove because they have small constituencies. If an AG wants to grab money, they definitely will target the smaller companies that don't have the ability to defend themselves as the low-hanging fruit for free money.
Yeah, no, I get that. It's the KGB head chief Lavrenti Beria, said, "Show me the man, I'll show you the crime." And
Exactly.
I forget who said the felony one, but that clearly can happen. Literally, it's happened to me. I don't want to get personal, but I had a medical license. I was in practice 30 years, and I was suspended when a narcotic addict got angry at me, basically. And out of the thousands I saw, to get a few addicts angry is not an impossible task. And if they complain, that's not an impossible issue. But in a political atmosphere that did not favor my views about sobriety, which is a good thing, and getting off narcotics, which is a good thing, and
Mm-hmm.
basically my thought crime was not seeing narcotic addiction as a disease. That made upheaval in my life, and effectively to the cost of millions of dollars in income lost and whatnot. My legal fees didn't run that high because I mistakenly used my previous lawyer from other tasks and whatnot. And maybe it should have cost me millions of dollars. Things would have happened quickly. So I got my license back, but it certainly shows you that you are playing with fire, or whatever other metaphor you want to use, when you're dealing with a state that doesn't like you. And they certainly have the power to shut down thoughts and ideas they don't like. And we've seen that obviously during COVID. So you want to, I don't know if you want to take up that mantle at all.
Sure. I mean, we saw something very similar with hydroxychloroquine and ivermectin when they were distributed during COVID. We don't even have to comment on whether they work or not. What we do know is that they're certainly safe drugs. You're really not putting your patient in danger when you give them out in various safe doses, which almost all of the doctors who were distributing them were giving them in safe doses. And then there was a massive Bolshevik movement to take away their medical licenses or even go after them criminally when, it's in statute that doctors are allowed to prescribe things off label. And that's because of the Hayekian idea that information isn't completely centralized. And a doctor might know something about the unique situation of a patient that isn't um, that like the FDA and other regulators really can't investigate and prepare for. So for that reason, they allow off-label prescribing of things that are already FDA approved, and in some cases things that are not FDA approved, but definitely things that are FDA approved. So this should have been completely legal activity. What the doctors were doing was not harming the patient, and that's the only metric you should be looking at. Is this doctor behavior harming the patient? That's the only thing you should think about when you're trying to take away their medical license for various types of medical practices. But it wasn't about that. It was completely political. They basically they basically saw ivermectin prescribing as synonymous with being a Trump supporter, and they went after them as if they were Nazis, and a lot of people were harmed in that. But then the entire health establishment was discredited, and now everyone in this public health atmosphere is looking around is like, oh, why does no one trust us? It's like, um, yeah, if you don't know why, then maybe you shouldn't even be practicing health in the first place.
So that's an excellent point. So there's the tragedy of the commons. You are pursuing a PhD in epidemiology. Um, I went to medical school. I recall there were pterodactyls and Tyrannosaurus Rex stomping the earth. I think it was the late Paleozoic, I forget, episode. But we were taught that we had a relationship with the patient. So I know there are a lot of epidemiologists out there. I don't know if there are any patientologists or iatro, whatever the Greek Latin term would be for somebody who studies this aspect of the compact between the doctor and the patient. I am there to treat. It's almost like an attorney situation. Guy goes in. Even the guy kills the business executive. He's going to have an attorney. I would just as soon skip that. OJ slices his wife's throat and some waiter's throat. Ancillary. I would skip all that and whatever. You look at the video these days and boom, you're all done. I mean, I can't do that. Everyone deserves a day in court and so forth. But it doesn't seem as if the patient is getting that same kind of legal right as you do with your kind of sacred attorney-client privilege. I don't think we're getting doctor-patient privilege in the same way as we're getting societal privilege, usurping, and whatever the word for rock paper scissors, intersectional, supremacy over the private individual bond with your doctor. You are. I'm going to have in the next week or two on my show a young woman who's a mother of 3 kids, and she's not an expert in this stuff, and she's going toe to toe with the pediatricians because she likes vaccines, but she doesn't like every single one for every single instant. But we seem to have potentially the tragedy of the commons acting upon us. That everybody has to have every vaccine, or else none of us are going to be healthy. You were talking about kind of the field of medicine, getting in the doldrums of public opinion because they've abused this public trust. Um, you know, how much part of it is kind of this academic bulwark of epidemiology? No offense personally, as kind of treating people as objects within some greater system. We're just pieces within the chessboard. We're Lego blocks within some big massive endeavor.
Just to begin, the field of epidemiology itself and the specific study of it is a wonderful field. It is a modeling of how things spread, the idea of R naught, the infection coefficient. And this is how we learn about the things you were describing earlier in the show, right? If something has a very high death rate, it's not capable of spreading throughout the population. And the infection ratio is negatively correlated with the death rate. So there's a lot of important things that come out of epidemiology. The issue is that you have a bunch of people who are studying this field who aren't focusing on those types of questions, and it's somewhat been turned into an advocacy type of degree where people will look at programs that they think are good for various reasons, whether they're political, personal, or whatnot. But the conclusion that they're good is made in the first place, and then they try to find evidence to support those policies. And where this becomes an issue with government is that there are various special interests that seek to profit by having their programs put forward. And then they can just try to find people to rationalize these programs so that they can siphon money from the coffers of the government and taxpayers. So it's once those types of incentives get mixed in with trying to justify government purchases where you really see these types of problems. At the patient doctor relationship, that's a little more tricky. I really can't put my finger on what's happening there because you'd hope that these doctors would want to have service, and that when they take the Hippocratic Oath and various other types of moral obligations, they're doing for the patient what the patient would do for themselves if they had that information. But the doctors oftentimes are going further than that. They're basically saying, well, I have more information. If you had the information I had, you would want all the vaccines anyway. So you're not capable of making the decision on whether you should be vaccinated or not. And I think that's kind of the dilemma, is that they, in the paternalism of trying to make the best decision for the patient, they've taken over the moral issues of the patient. They think that their superior knowledge, and oftentimes they don't have superior knowledge, but they think that their position of having superior knowledge in a legal sense gives them the obligation to tell the patient exactly what's going to happen with no sort of rebuttal from the patient. And that's completely at odds with what the Hippocratic Oath was actually supposed to mean in the first place.
Well, it's funny you bring up the Hippocratic Oath. There are now multiple quasi Hippocratic oaths
Yes, it's
being
been changing. I've
undertaken.
been reading about this and it's a little concerning. Yes.
Um, there was some right wing group called the Oath Takers, I think, um, and I took the Hippocratic Oath. It didn't seem controversial at the time, but I do think it's being uh, morphed into something that's a collectivist approach, um, and there seems to be a Marxian tint and taint throughout a lot of academia in general. Um, but in this realm of public health, I mean, I look at the journal. I forget the way their acronym is, but basically the major public health journal, American Association of Public Health, I believe. Um, it's one kind of Marxian trope after another. You spend any time on that at all? Have you? What are
Yeah.
your?
Yeah. JAPHA, the Journal of the American Public Health Association. One of the marijuana papers by Mark D. Anderson, or no, sorry, D. Mark Anderson, that's published in that. It's actually a very good paper, but I have increasingly seen various political movements in that journal. Back during the George Floyd riots, they actually had a call for research, which was based on like government fascism, and you can kind of see where they were going with that. So it seems like they have gone a little bit away from the pure science stuff and have kind of drifted in towards various types of advocacy. I actually attended the American Public Health Association meeting, I think my second year at Case Western, and won one of the dissertation, or sorry, not dissertation, one of the abstract awards from the students, which was kind of a big deal when that happened. So I'm somewhat familiar with the organization, and I can say that there are good people there, but the people, this is actually what's really interesting about like these types of organizations. Um, they have mini groups within themselves where people can like try to do advocacy within their field. So maybe the pharmacists have a group, epidemiologists will have a group. There's a whole bunch of different groups, and it's like who has the time to be doing these types of advocacy things? And it tends to be the people who aren't busy enough with the research. You know
Right.
what I mean? So that ends up becoming their entire personality. And I think in many ways, people replace religion with advocacy. Like everyone is actually going to be religious. Just what is your religion going to be? And for some people, it's public health. And if it's funded by the government, it's innately going to have a Marxist lean.
Yes. I mean, I think Chesterton said people who don't believe in something will believe in anything. Uh,
Exactly.
and yeah, no, I see a lot of that, and I'm not sure I have anything above and beyond what you said to add there. Uh, One thing I've had on a guest, Sanjeev Sablok. He's a Indian-born Australian epidemiologist, public health professor, and his point is that public health hasn't really done much for us lately. A lot of things that happened in terms of public health through the sanitarians, was it like 18th century and whatnot? Um, Fine, but better public sewage, better, fresh water, all that kind of stuff. Great, no cholera,
Yeah.
there's no
Plumbers
malaria.
save more lives than anyone.
But what have you done for us lately? I look back, the seminal article for me, I've written on this on Donald McNeil, who was the quasi chief science writer for the New York Times during COVID, and he literally wrote the book on Zika. So I've spent a lot of time, um, reading Donald McNeil. But his article in his podcast before that was to, the coronavirus, go medieval on it. Um, and he had been in conversation with Dr. Fauci, and that Dr. Fauci was like the biggest straw stirring Donald McNeil's drink. And he'd waited literally for Fauci's word on this before he published that article. And the idea was we should go medieval. Now, medieval is not really where you want to be in a public health sense. They were the same, medievals were the same people who locked up, Jews in a, synagogue in Mainz, Germany. Well, it wasn't really Germany at the time, but German area. Um, you
Also, a
know,
lot of people died during the medieval epidemics, right?
yeah. And so,
Like,
so, so, so,
doesn't seem
so
like
they
a
wanted
good path.
Yeah, so they wanted to go medieval by locking people up and throwing away the key, and somehow that's going to like train these viruses not to transmit to people and whatnot. So, but so Sanjeev Sablok's point is that they've been wrong about everything. Where has public health been right, and what how do we learn to trust them? Should we, and whatnot? When we see transing the kids, wound up in the British Supreme Court. I didn't even know they had one. And it took a bunch of jurists to say, "Oh, that's a woman." When the doctors have like abdicated, thinking about this kind of stuff.
Yeah. Um, there's a lot to think about there. Where has public health been right? You know, the development of various prescription drugs, um, I think is clearly a win. I think the pharmaceutical innovation has been great. Um, where I was at prior at the Cleveland Clinic, they are one of the leading heart surgery centers in the entire world, and they are increasingly becoming better at various types of procedures and whatnot. But the more I speak, the more I realize that these really aren't public health per se. These are more medicine, and public health is different than medicine. In fact, like they both touch on health, but public health is the idea that you can make government level regulations or government level interventions such that you want to help the entire group. They're basically removed from individual level interventions. So, where has public health actually been helpful in this regard? Man, this is tough. And it kind of speaks to like the issue with public health by treating people as a giant conglomerate instead of trying to go at people by as individuals. Um, unless like public health is like individually curated to help practitioners, physicians, surgeons, unless it's like actually formulated in that type of way, it usually is going to be harmful. Public health might have actually caused the deaths during the Spanish flu. There was a wonderful Oxford article written about how the public health suggested interventions to treat the Spanish flu probably contributed more to the mortality than the Spanish flu itself, because what was a very common treatment for Spanish flu was toxic levels of aspirin. And because aspirin was somewhat new at the time, they didn't really realize what the toxic levels were. But almost all of the deaths kind of follow what happens if you have toxic levels of aspirin. You have pneumonia that is bacteria formed within your lungs. And sometimes a flu can cause that as well. Sometimes this flu can weaken your immune system, and then bacteria ends up being there as well. But it is suspicious that what we know aspirin causes, it was definitely in many of the biopsies that were performed on people who died, and that the levels of aspirin that were given were certainly toxic. And one thing I actually kind of want to touch on is what happened in the medieval times, because people might say, oh, we need these types of interventions because sometimes drugs are virulent and deadly at the same time. But the Spanish flu, that was virulent, and my guess is that it actually wasn't deadly. It was the government's interventions that were deadly in treating it. And then the same token, what was happening during the plagues? Here's like the factor. What is the vector of the disease? So with like flu, COVID, humans are the vector. Humans are spreading it to each other. But if you have a pathogen that spreads not by a human, then the death rate is irrelevant because the vectors aren't being knocked off by the death. The entire thing is that the vector needs to stay alive. And during the plagues, the vector was rats. It really wasn't human to human transmission. It was mostly rat to human transmission, which also speaks to the public health interventions of cleanliness, sewage. So yeah, I guess what public health is doing right now is probably like if there are like efforts to try to cull vermin in the city, that's probably very helpful. Um, if they're keeping sewage clean, that can be very helpful. I know that there's public health efforts in Cleveland to remove lead from the pipes and water. And they're even going into individual houses that have lead pipes and they're trying to cover the pipes or replace them. So there are some issues where public health can be very useful, but that tends to be at maximum like the city level, a municipality level. And once you get to an entire nation, and then you have a public health apparatus that's trying to regulate everyone at once, well, they just don't have enough information to make that effective.
Yeah, I like your minarchist label, and I might try to use that myself because I think that the government should be acting in those spheres, and to wit, a lot of the things that are extra, including the big public health bloat or apparatus, I think become counterproductive. It becomes just kind of a mutual admiration society and whatnot, and a way of advocacy from on high of certain ideas and ideals, which may, and I remind you, are usually inimical to the populist desires. And like for instance, this various times is the food pyramid. There's all these kind of now it's a lot of emphasis on sexual this and that, or condoms in the school, or harm reduction, or clean needle exchange. A lot of public health stuff is niche, that's dealing with certain problems that I guess for which they have an affinity, or their voting blocks might wind up in trouble. But if you actually look at longevity, um, or maybe kind of quality of life longevity, quality and quantity mixed together, the people who live the longest apparently are those who are married, who go to church, who do community activities and so forth. And you'd be hard pressed to find any kind of public health effort within schools to tell you to go find the right spouse, be monogamous, learn to love somebody, build a household, go to church, all that kind of stuff. Those things are associated, each of those are with 2 to 5 year increase. I'm not saying that makes you live longer. The joke would be when you're married it only feels that way, but most of the time they align with your concept of moderation, and and that doesn't seem to be part of the public health mantra these days. We're kind of closing out our hour shortly, but I wonder, if you want to talk on any of those things, whether any of those things involve public health, or in a minarchy, whether it would be self evolutionary, self kind of like congratulatory, and grow more organically based on what societies are, and how, frankly, this country got started in the first place.
Sure. So, like in a minarchy, you probably wouldn't have active interventions to sabotage those things that contribute to health. One of the reasons why we have issues with people becoming married is because the government incentivizes against marriage. So, for one, the amount of benefits you receive the government for being a single mother are often much higher than the benefits that you will receive if you stay in your family. And incentives matter, and people do act upon incentives, not even consciously. They don't even have to rationally know why they're doing things. Just these types of forces are like gravity, and they pull you. And another issue that's really interesting, I won't name who this individual is, but this individual is very close to me. And before they had their first child, they got married because they go to church, and they turned in their marriage certificate. And then the government rejected it and said, this marriage certificate is not filled out right, blah, 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 blah. And then they talked to their tax advisor, and he said, well, what you should probably do is just not officially be married. Just be married in the church, because that's all that matters to you. So be married in the church. And then both of you, when you both have your kids that you're intending to have in the next 2 years, just both of you claim them as single parents. You'll save like so much money on taxes. And it's like, yeah, that's exactly the system. And honestly, God willing, I get married. If I could find a lady who's willing to do that, I totally would, because in my opinion, the government should have absolutely no involvement with
Yeah, I know that.
marriage. I don't
It's
even
funny.
want to be having a gay marriage like debate, because the government should just not be involved. It should be
Yeah.
between you and your church. It's an agreement with God. It's not an agreement with the state. And just because the government says something is a marriage doesn't make it true. The government can't say like 1 + 1 = 3 and it's true. they can say that's the legal statute, but that's regard that's irrelevant to the truth.
Well, it's hard to top that. So thank you so much, Jacob James Rich. You can find him on X at
Jacob James Rich. Yep, just all one word.
easy enough. And he writes for reason. I recommend you follow his posts. I find them illuminating, and I'm really honored that he spent the time with me today. So thank you again.
Yep. Thank you so much for having me. It's always a pleasure, Randall.